Have you been struggling with unexplained fainting, dizziness, or heart flutters, and your tests still don't have answers? That's where a loop recorder comes in. This tiny device watches your heart around the clock, helping uncover rhythm problems that other tests can miss. In this episode of the Pulse Report, I'll guide you step by step through loop recorder implantation, what it is, how the procedure works, what recovery looks like, and how it fits into your everyday life. Welcome to the Pulse Report. I'm Dr. Shen, a cardiologist specializing in electrophysiology and the Director of Research and Education at Cardiovascular Medicine. By the end of this episode, my goal is to give you a clear, step-by-step picture of what to expect with loop recorder implantation, so you walk away feeling informed, confident, and reassured. Let's start with what happens before the procedure. A loop recorder is a small device that continuously monitors your heart rhythm. It's often recommended if you've been experiencing unexplained fainting, dizziness, palpitations, or if you're at risk for certain rhythm problems, but traditional testing hasn't given us clear answers. Before the implant, your care team will review your medical history and medications. Unlike bigger heart procedures, loop recorder implantation usually doesn't require major changes to your medications. You may have some routine blood work or an ECG beforehand, but extensive testing isn't usually needed. On the day of the procedure, you'll check in, meet your nurses, and go over the consent process with your electrophysiologist. Most people don't need general anesthesia or sedation. It's a very quick and low-risk procedure done with local numbing medicine. For the procedure, we'll begin by cleaning and numbing the skin on your upper chest, usually just to the left of the breastbone. A tiny incision, less than an inch long, is made, and the loop recorder, which is about the size of a USB stick or a large paperclip, is slipped just under the skin. Because it's so small, there are no wires that go into the heart, and no leads that need to be threaded through veins. Once the device is in place, we close the incision with stitches or surgical glue and cover it with a small sterile dressing. Most patients say the procedure feels like a quick pinch and some pressure, but not painful. The loop recorder implantation is much simpler than other device implants. The procedure usually takes about 15 to 30 minutes. Right after the implant, you'll stay in the recovery area for a short time, usually less than an hour. During this time, your care team will check your heart rhythm, incision site, and blood pressure. The device itself will also be tested and activated to make sure it's recording properly. Because the loop recorder sits just under the skin and doesn't touch the heart, recovery is much quicker than with other implants like pacemakers or ICDs. Most patients go home the same day without needing to stay overnight. Before you leave, you'll be given instructions on wound care, activity, and when to return for a follow-up visit. Once you're home, recovery is usually very straightforward. For incision care, some mild bruising, soreness, or swelling is normal and usually fades in a few days. Keep the site clean and dry. Showers are fine, but avoid baths or pools until the incision is fully healed. Leave the dressing in place until your wound check, which usually happens about 7 to 10 days after the implant. For activity, you can walk, climb stairs, and get back to most daily tasks right away. Just avoid heavy lifting or stretching that pulls on your chest for about a week. At your follow-up visit, your doctor will check the incision and confirm that the device is recording correctly. After that, most of the follow-up happens automatically through remote monitoring, so your care team can check on your heart rhythm while you're at home. It's normal to experience a few mild symptoms as your body begins to heal. You might notice some soreness or tenderness around the incision site, and that's part of the healing process. A small bruise or bit of swelling under the skin can also appear, especially in the first couple of days. There might also be a slight bump where the device sits. These mild changes are part of normal recovery and typically improve within just a few days. Now, let's talk about what life looks like once the device is in place. A loop recorder is designed to last up to 3 years, although it can be removed earlier if we've collected enough information. Removal is also a simple outpatient procedure. The loop recorder continuously records your heart's electrical activity, but it doesn't treat rhythm problems. it's purely diagnostic. To get the most benefit, the loop recorder needs to connect to a transmitter. The transmitter may be a small bedside unit or, in some cases, a mobile app on your phone. At night, the transmitter sends your recordings automatically while you sleep. If you have symptoms, you can press a button to send information immediately. Without the transmitter, the recorder still captures data, but your care team can only see it when you come into the clinic for a download. Most of your follow-up with a loop recorder is done remotely through the transmitter, so you won't need to come into the clinic very often. In fact, most patients only need in-person visits once or twice a year. Your doctor may also ask you to keep a simple notebook of any symptoms you notice so we can match them with what the device records. Once you've healed from the implant, you can return to a full and active lifestyle. There are no long-term restrictions with a loop recorder. You can exercise, travel, and go about your life as usual. If you're traveling, just remember to bring your remote monitor or transmitter with you. That way, your device can keep sending updates to your care team no matter where you are. Everyday electronics are safe. Things like microwaves, cell phones, and household devices won't cause any problems. Airport scanners and security gates are also safe. Even medical procedures, like MRI scans, are generally safe with most newer loop recorders. Still, always let your care team and the imaging staff know you have one before the scan so they can confirm. Loop recorders are very safe, but it's still important to know when to reach out to your care team. Call your doctor or device clinic if you notice increasing redness, swelling, drainage, or pain around the incision site. Also, let them know if you develop a fever or chills, which could be a sign of infection. Because loop recorders don't deliver shocks or pacing, they shouldn't cause any sensations or discomfort. If you ever experience new or worsening symptoms, like fainting, severe palpitations, or chest pain, it's a sign to get medical attention right away. Your care team can check your device remotely, review any recorded events, and make sure everything looks normal. A key advantage of a loop recorder is that most people can return to their usual routines fairly quickly. Most patients are walking, eating, and doing light chores within 24 hours. By the end of the week, nearly everyone is back to work and normal activities. There are no long-term restrictions. Once the incision heals, you can exercise, travel, and live your life as usual. Your first visit is usually within 1 to 2 weeks to check the incision and confirm that the device is transmitting correctly. After that, most of the monitoring happens remotely from home, with in-person visits needed only once or twice a year. So that's the loop recorder procedure in a nutshell. Quick preparation, a brief 15 to 30-minute implant under the skin, and a same-day recovery with only mild soreness. A follow-up visit within a week or two checks healing and device function. Once healed, you can return to normal life, working, exercising, traveling, and living with the reassurance that your heart rhythm is being monitored around the clock. A loop recorder helps your care team track your heart rhythm continuously, making it easier to find the cause of fainting, palpitations, or unexplained symptoms, and giving you peace of mind as you get back to daily life with confidence. If you found this guide helpful, please share it with loved ones who may be preparing for a loop recorder procedure. And don't forget, you can find a patient-friendly pocket guide linked in the episode notes. Thank you for listening to the Pulse Report. I'm Dr. Shen, and let's keep your heart and your life going strong and in rhythm.